wetin we dey talk about today, but living with fibroids, what every woman must know. And so as today na that we dey look at na the program. Let's start for tell family the first wetin na fibroid.
Fibroid na growth wey dey begin grow pan the womb or inside the womb incessive. Na something wey we dey call benign, that not to cancer but na like growth wey don begin grow pan woman in womb. And it can also grow inside the womb, it can grow pan the womb, or it can grow outside the kinkile don we can call her submucous. Na thing wey it can among boku woman dey about 70% of women dey can actually get fibroids, but na like 30% of them go actually get symptoms when they present with. Boku woman wey you see dey pass, so if you decide for go check her normal, you do scan panel, you go find out say e get one form of fibroid. But that 30% then they actually suffer from in the form of pain or in the form of bleeding when they get, or some people then they say they can even get what we call urinary symptoms where it go make where you go feel like say the person get infection na a bladder, but all get for do with the fibroid problem. Fibroid can even same way so ambog some people they born one. It can even make some people it will make they not able to go yard freely if you be saying one way big. So na problem we can affect woman them, but the common way when they can present with na like some man go tell you say in belly they swell or it they bleed or it they feel pain na in bottom belly.
Okay. So you don't mention some of the things them waiting a fibroid and waiting some of the things way fibroid on the do. So you mentioned one way na the urinary symptoms. Waiting na they mean exactly.
So the bladder outside a skin store by anybody in woman there it dey very close to outside the womb dey. So if it be say any growth dey inside the womb, it go the press pan the bladder we go make the bladder, even if the person that in piece back they not full up yet, it go begin feel like say it don't full up because something they press panel. Or it can make like say it dey feel pain when it want wet, or it can make if you even the fibroid big enough, it can even make the person can find it difficult for make it able wet because it go dey block outside the pipe they come up at the kidney for can inside the bladder.
Okay. How come on this urinary fibroid dey per woman them?
It very common as I say now like if you take two women per every three women there, you take two of them, they must get fibroid, and then per then 3 out of 1 go actually get symptoms. But boku women then they live with fibroid where they don't get no symptom, but they get fibroid. You go just find out incidentally, and then you get women then now we then go get fibroid. They don't get then they actually present with symptoms. And for make you know, we the black woman then fibroid very common to be. Yeah. So not to think where you go feel saying like isolated something. Boku of we if they say then they go screen we now for fibroid, you go find out say who boku will get her. Now just that not to all man they present with symptoms.
Okay, so let's look at waiting at some of the causes them of this fibroid.
So fibroid they say it gets specific cause where you go say na this na the cause of fibroid, it not well known say na this the cause am. We only get thing that we will say na possible risk factors there we go make it go make the person get risk for get fibroid. One na that you race for woman the winner blacks there, whether na African or Caribbean origin, genetically we get risk factor for get fibroid. Then people then we get body small, or they call and say obese people there. So then people then they then get high level of estrogen, we na one of the things that they wake make fibroid can grow. Then the age group, if we say you in a reproductive age between age 16 to age 49, you also get risks for get fibroid because at that time day your estrogen level high. most of the time we can find out say people that we get fibroid when they don't reach menopause, then fibroid level can actually either begin shrink. If it begin continue for grow after a menopause, we can actually worry but and say it possible say it don't begin turn to something else we not to benign or not to one we know they cause cancer. Then also exposure to estrogen use, because estrogen na chemical wey e be say the woman ovaries dey produce, wey e can act inside the womb for make make fibroid grow. So if e be say you get high level of dandy or you get any source of food or diet wey dey increase estrogen, also can predispose you for get fibroid.
So plenty people don't they ask if fibroid cancerous or dangerous.
Fibroid generally na something wey na non-cancer.
Okay.
However, people the way they get cancer above beyond menopause, wey we dey expect say the level of estrogen no dey grow that time dey. Then one then the way they get fibroid, we can actually worry say it dey turn to some wetin we dey call sarcoma. That na the way cancer of the womb, the muscles of the womb can don candy. Where e be say fibroid and the muscles of the womb actually can affect it dey affect. So generally fibroid na something wey na benign something, but once in a while some then can turn to cancer.
Okay. The program now, well, Body Talk, it comes to live from the Society for the Democracy 98.1 FM. Remember, say yourself where they listen and watch we live on Facebook, you go be part of the program. By way, go send a comment or text message to the number 077981981, or self you go now already Democracy Facebook page. And today inside the program, we talk about living with fibroids, what every woman must know. As today, I get with me Dr. Rosalita Jaida Tugagu, and a senior registrar obstetrician and gynecologist at the University of Salon Teaching Hospital Complex. And today's the program about Body Talk. We talk about living with fibroids, what every woman must know. So let's start for look at again, waiting at some of the signs and symptoms them of this fibroid.
Okay, the common thing then we possibly get fibroid go present with now possibly go begin see in period. The period go heavy past how it can normally dey. Say you can see a period day something at 2 parts they change. You go now begin see a period they maybe use 4-5 parts per day, or you go begin feel pain at that point they. And the other thing back, some man go tell you say my belly don't begin grow. Some man go even begin feel say he get belly, but you know get belly na actually growth he gets na in womb.
Okay.
So some man in belly can swell. Take it reach like we supposed to get 9 months belly. And then some people then they apart from the pain and the bleeding we then can get, it can make that can even get difficulty for get sex, because if you get mass where they grow inside the womb, it can also make you get discomfort during sexual intercourse. Fibroid can also affect people there in different way. If it depends on the location self where it is. So man they it will be say they just get frequent miscarriages there, and then when you try for investigate, you will find out say fibroid they will see inside in womb where they make belly not go able to continue for grow until that fibroid they come on. And some people then they self it can happen say like he get belly but the belly not they go far, the baby not go mature then he deliver because a mass they grow na the womb. And then other thing then way the fibroids can do is that you go begin feel like you want wet, but you go begin feel like you want wet fast. Okay. Or some man they in belly he say in belly dry because the fibroid they press on in God's way they make say to know they pass for common find how it's supposed to come on. And other things the way fibroid can present with, it can, if it be say that fibroid they begin grow there inside the fibroid get problem, a call what they call degeneration. That kind of pain the person not to even menstrual pain again, a pain way go more than that person they pass it go need for make the do surgical intervention for.
So which age more prone to this sick care?
Now reproductive age between 16 years and 49 years, where it be said at that time the way people that you don't begin see them period. That time the way they see a period, you monthly menses. At that time the way you prone for make you get a fibroid.
Because plenty I don't they suicide young girl picking like way they start in menses, they see and plenty one. So we can normally say na normal something maybe na so you don dey mess. In your case for like woman dey mess for 1 week or e like way dey change the pad like 4 to 5 times for the day.
So girl pikin the way dem begin see dem period newly, the first 2 years dem period no kin normal.
Okay.
Some dem can begin see dem period either boku or some dem no can even see am every month. So then one dem dey, except if we find out say problem dey, we can take am say na normal variant because dem period dem body no don adjust yet. However, for make you begin see a period more than 7 days, then na something wey abnormal. If you begin see menses wey dey begin change 4-5 parts, e mean say you dey bleed significantly because the entire menstrual flow wey you suppose for dey anything not more than 80 mils. So if e be say you dey change 4 parts per day, meaning you don begin dey mess more than the quantity wey you suppose for do, na abnormal something that day. So that means say you go need for see doctor.
Okay. So again, now look at some you know don't get any case of why any woman they get C5 when you know say get her. Like you know they get some of them symptoms there, so we just mention.
Oh, but who tell them the patient go come for different reason. You just send her for go do investigation, then you notice say he get fibroids. Where he not come tell you saying bottom belly dey out or anything, he just come for wellness check and then you notice say he get fibroid. Then they can happen boku. Now I tell you say boku people they can get fibroids, but not to all man can present with symptoms. So now the few then the way now through routine investigation you go find out say they get fibroids. And then some then they go actually get problem, they can't complain. The way you find out now you see say they get fibroid.
Okay. Continue for the with me at the program. The program now will Body Talk. It come to you live from the Society for Early Democracy 98.1 FM. Where now they can ask the question them for last week program. Also, anybody will go answer one panel question. They also go get a 50 million stop up. And the number one question are what is the phrase used to describe glaucoma? So you go call the number 077981981 for answer that question there. And question 2 na name 2 causes of glaucoma. And question 3 na how can we prevent glaucoma blindness? Question 4 they say how do we manage patients diagnosed with glaucoma? Question 4 they say proper glaucoma. Okay, so that's now the question the way they for the last week program. Also we'll look at glaucoma. So the number where you call now 077981981 077981981 at the number where you call and answer that question there and get you 50 million stop up. The first question are what is the phrase used to describe glaucoma? The second question are name 2 causes of glaucoma. The number 3 question are how can we prevent glaucoma blindness? The number 4 question are how do we manage patients diagnosed with glaucoma? The number for call now 077981981. As we don't get to first caller na the program for answer to this question. Hello, good evening. Name and where you call from?
Yeah, my name is Suleiman. I call from Lumley.
Okay, Suleiman, go ahead and.
Yeah, question 3.
Okay. Yeah, how can we prevent glaucoma blindness?
Well, so according to doctor, always if I go for checkup without nothing on the eye. If I go to hospital, let you do checkup.
Yes, so do it again.
Then immediately you detect anything that you feel something in the eye. Then if I go to hospital before you buy any eye drop, you go to the qualified people away that they work with eye.
Okay. You get any other one you get for a day?
No.
Okay. Well, plenty thank you as she's don't win a 50 million stop up for you don't answer question 3 when early detect when how can we prevent glaucoma blindness where you don't mention early detection. Plenty thank you we call and answer that question in the program. As the program done, we go send you 50 million stop up. Plenty thank you.
Yes, thank you very much.
Okay, we don't get another call now the program. Hello, good evening. Name and where you call from? Hello?
Yeah, good evening. How are you?
Yes, go ahead and answer the question we want for answer.
Question 2, causes
Yes.
of glaucoma.
Yes.
Yeah, family history,
Yes.
then an age factor, 40 above.
Yes. Double 20 again.
Yeah, I think these are some of the causes.
Okay. Family heredity. You get So plenty thank you. Where you call and answer that question there, we go send it up.
Okay, thank you.
Okay. Yeah. The number for call and answer some of the question are 077981981, 077981981, and the number where you go call and answer the question. So we'll ask question 2 and question 3 don't go. The question left question 1 and 4. Also want to say what is the phrase used to describe glaucoma na question 1 that day, and question 4 where the doctor will be able to respond at the program now. How do we manage patients diagnosed with glaucoma? The number for call and answer the question is 077981981, 077981981, and the number for call and answer the question and win 50 million top up. And not forget for listening to the young program as next week we go open phone line so people will call the number and answer some of them questions here. So hello, good evening, name and inside the call form.
No, Suleiman again. Am I allowed to answer number 4 question?
So Emma, you go make other person self able for be part of the program and itself go in.
Okay.
Okay, thank you very much. Yeah. Okay, we don't get another call at the program. Hello, good evening. Your name and inside the call form.
Yes, ma'am. Good evening, ma'am.
Good evening.
I will call from Mr. Rodman.
Okay, Tene.
Question 4.
Yes.
We manage glaucoma by the treatment. When you go for early detection, they begin treat them. If you now reach the last stage, the local manager by the treatment, where they go for checkup, where they do the treatment, they do follow up.
They will 20 again.
Hello?
Yes, I they get you. You get all the answer again for Ade.
No.
You dey close and I want for late try. Hello, Tene?
Yes.
Yes, I want late try.
Like when you go to hospital, you go do a checkup. The doctor they check it. That's all we know. I don't see that even everywhere.
No, Tene, that's not a question for your answer. And I think they try for answer question 3 where they middle already answer na the program.
Okay. I didn't answer question 1.
Okay.
You
Well,
said the
question 1 they
physical-
say what is the phrase used to describe glaucoma?
blindness.
Yes, you're correct.
Okay, thank you.
Okay, it only left question 4, and question 4 they say how do we manage patient diagnosed with glaucoma? Well, that's not the one question we don't left, and now we come to the studio guest winner Dr. Rosalita Jaida Tubabu in a senior registrar obstetrician and gynecologist at the University of Salon Teaching Hospital Complex. And today inside the program well, Body Talk, we talk about living with 5 words, what every woman must know. So doc, we don't look at some of the signs and symptoms and woman the way they get the sick, way not you know. So how did they diagnose fibroid?
For every sick we person get, you go meet with our hospital.
Yes.
First, we get for take history from you. They ask you questions there about the problem we come with, and based on them questions, the way you don't answer for we the sound you who they say we the examine. We go touch you belly, touch you other part of the body for find out what happen. Then we dey do investigations there. So one common thing we can use for do investigation for fibroid wey common now in our community now for use ultrasound scan. You can find out say man they say now I want go make them go scan me. They go do scan different way. They can either put the probe that the one with the part of the machine when they put on the belly for scan your belly part, or they can also put her inside the vagina, as they say, we call it transvaginal ultrasound scan. You can do that and day. For fibroid we very big, you can prefer for make you do at the abdomen. But for fibroids then we not big, you can find for do at the vagina, so that you will able get better image of the fibroids. The other investigations and the way you can do for also check for fibroids now, like you can do that an advanced one. Then now you can use laparoscope. You put make a hole on the belly, and then you put breezy. You put camera and watch see what it is inside the belly, or you can also do that same camera they pass inside the vagina and go watch inside the womb. The other way than the way you can check for know if possible fibroids. Other advanced investigation that we can do then are the magnetic resonance imaging. You can use MRI for make you also check if possible fibroids. Yeah.
Okay.
But then when you investigate fibroid, you go do other investigations and now in case you want to operate the possible for like low blood level, check if in kidney they work fine, in liver they work fine. But really for check for fibroid, now we examine the patients and then you do scan. The scan can be ultrasound, it can be MRI, or you can actually watch directly using laparoscope, hysteroscope, the one in there. Yeah.
Okay. So let we take this call now the program quick. Hello, good evening. Name and who's the call from?
Good evening, how are you?
Fine.
I come from Britain. The management of glaucoma. Hello?
Question 4. They say, how do we manage patient diagnosed with glaucoma?
Yes, according to glaucoma now, it's so asymptomatic. So it is not, it is managed, not treated. Also, it is, we get glaucoma detected early. It will be treated either by surgery or so. But at the same time, again, if you not detect, if you not go early to the hospital, only it will lead to an NC, that is, it will cause blindness. So it's reversible.
Okay. Plenty thank you. As you don't know the last possible win the question 4. Plenty thank you where you answer that question in the program, and thank you for listening to Radio Democracy on Body Tok program.
Thank you very much. Thank you.
Okay. The program now, Body Tok, they come to you live from the Society for Radio Democracy 98.1 FM. Well, the questions them for last week program done as or plenty as they don't answer all for the question that we don't ask for last week program. And then yeah, you radio or you go now Radio Democracy Facebook page and listen to the program as we get another set of questions and we go come now the next edition of the program Body Tok. And today inside the program Body Tok we look at living with fibroids and what every woman must know. So Doc, this anything where the lifestyle or the food way they eat gets anything for do it for make a woman gets fibroid?
Yes. So initially we mentioned say one of the risk factors there for make us say baby get fibroids like you obese.
Okay.
So if now person will get body and if you the exercise and try for control your weight, then that now one way where you could help for minimize your risks for making get fibroids. And then now this ETRO like then fast food then food the way I know they say chicken a bad thing no, but
Okay.
we get high level of estrogen. So then kind food then they increase your risks for making get fibroids. So people then where they eat well, healthy diet, and where they exercise, they also they minimize the risks for making them get fibroids. Although some other risk factor then they way like na genetically related thing the way you not go able to change your gene, whether they but at least then risk factor then like obesity, controlling your diet, exercising, then what then they you can able to act on as your lifestyle way they change for reduce the risks for get fibroid.
Okay. How this fibroid they affect the woman in daily life and well-being?
So some people then the fibroid can give them more and give them pain way go even disturb their activity. You know say if you get some kind pain, you know they able come on and do or go do normal activity. You go see somebody go tell you say a day on my period and this period pain here is so heavy that are not dey able go work. If that person not able go work, it dey become less productive. If let's say na school pikin, it go be absent na school because of that fibroid dey dey mourn am. Imagine, let's say, especially if you married dey na married also you no born pikin, then you can't get one kind growth. You belle dey big, or man if you say you get belle, and that social stigma for so e dey attach. Belle don big tey but we no see pikin, you know, all them one then they also get a way it dey affect person. Then if you dey see period, you dey bleed boku. Anemia go make you constantly tired. It go make self you get risk from the left for pass you for done because you hate the turn. Okay. It go also reduce your productivity, and it go even affect your heart. Begin make you get anemic heart failure just because you lost boku blood. And then when you come to the location of the fibroid, if now one way they don't inside the womb, outside picking suppose they don't, it they make it they get miscarriages, all and they go affect your life negatively. And then you think of constipation, you know they will pass through, your belly go they at you, your belly go you go feel bloated. So now one other way than the way they make you feel sick. Okay. In general, it will make you go feel sick. It will affect your daily activity. Socially, it will affect you, especially that one we don't begin grow. They begin make your belly look big. For aesthetic reason, you just not go feel comfortable if you not get belly. Then your belly big. No, so yeah. So that one way than the way it will affect person. And then the complications themselves where it will arise with the fibroid of itself, it also get health implications there because the anemia, we go see anemia as something when I joke, but anemia no, when you get enough blood, it go make it. They get blood, they go find your brain, they work, it go make blood go find to your heart, to your kidneys there. But if you don't get better blood inside your body, all the one and they will be affected. You not go able to concentrate. Even your productivity not go be good. You not go able to think straight because you anemic. And the heart, now the first thing we go when you get anemia, and then when the heart don't fail, any other organ go follow suit small. So not to think way for joke with. When you get symptoms we look like fibroid, you go see doctor, they see you. If now one way need for common, then go pull them. If now one way they need for manage with medicine at that point, say then go talk to you, but not just go say they go take one country medicine, this maybe leg go come broke, then kind thing, and they go left and more problems for yourself.
Okay, so we can look more into the treatments now. We go for break now the program.
Oh yeah. You know it is. You know we go. You know. For the longest while we're jamming in the party, and you're waiting on me, pushing everything right back on top of me, yeah. But if you think you're gonna get away from me, you better change your mind. You're going home. You're going home with me tonight. Let me hold you, go caress my body. You got me going crazy. You turn me on, turn me on. Let me charm you, go right on around me. You got me going crazy. You turn me on, turn me on. When I get on, I go get tonight. When she thinks a man, I go fight. Me don't feel that with back on, that's right. Walk on play where I fight. One on the ground, a bumper cock sky high. Whining hard on me, got my python. Hollering for mercy, yeah. Then I whisper in her wrist, wine harder. And then she said to me, boy, just push that thing. Push it harder back on me. So let me hold you, go caress my body. You got me going crazy. You turn me on, let me jam you. Go wine harder on me. You got me going crazy. You turn me on.
When Fambula option and I enjoy that song then at the program. The program now well Body Tok, it comes to live from the Society for Any Democracy 98.1 FM. And where they bring this edition of the program well Body Tok, my name is Karifa to Conte. And today inside the program, we talk about living with fibroids, what every woman must know. And I get with me Dr. Rosalita Jaida Tubabu, and I'm the Senior Registrar Obstetrician Gynecologist at the University of Salon Teaching Hospital Complex. So, Doc, let's look at again which stage where this fibroid they reach per woman we una can diagnose say it get where una go decide say una for do surgery or na medication una dey give the patient.
So, fibroid in management, it depend on the symptom where the patient they get.
Okay.
So, people then they go get fibroid where they na one location where no they unbug the woman in any way. You know, go say just because you don't see fibroid, that fibroid they for go pull and power. No, because some of the interventions then they get a,
So some woman they get fibroid still they get belly.
yeah, people then they get belly where they coexist with fibroid.
Okay.
And then you can actually born, and if you, after you don't born the fibroid they are more, and then you can get like 6 weeks or 3 months, then it come back later on for management of that fibroid after you don't deliver. But if it be say the woman don't get any symptoms where the fibroid they present with her, then what you can do na expectant management. You can follow up this woman every 3 to 6 months for see if no problem on it. But then one day we go present with pain, he presents it they get bleeding, he's presenting belly the big, not of the one, and then you begin tell the woman say go be another padan day. So then one and day you go need for act on them. So depend on the size of the fibroid and the location where it is. If it be say not to inside the womb it dey where it cause buccal bleeding, or at that point the woman herself not ready yet for surgery, it can start with some medicine. The first one we can start with now these contraceptive pills the who can take for make if you say person not get belly, you get other use. You can take her for make it help her with the symptoms of fibroid. So now fibroid na estrogen they make it a buccal. So what they do, they give them another hormone where they counter the estrogen, we not the progesterone. So we get device the way they put inside the womb, we call the intrauterine levonorgestrone system. It able use that day for make it thin the inside of the womb where the woman can shred every month where they make it a bleed. So if that day the layer not thick, where they mess, na small mess they mess not to boku why they mess. Then na one way down day. Or even the injection contraception we can use like the depot or the Sayana press, they one and they can use them also for counter the estrogen action. Or then the tablets in the back when a progesterone only tablet you can use standing. Then for deal with the pain and the bleeding disorder you can use like tranexamic acid tablets where then they na medicine where they use for making help woman in blood clot so that it no go dey bleed boku. But then we get other medicine then we can call non-steroids anti-inflammatory drug like diclofenac, ibuprofen. Then one they can also use them for help with the pain and inflammation. So that one is the medicine way they use. Then you get other medicine way you go use in your work now for actually go at the brain level. It go help for change the whole way how the cycle they happen so that the woman they stop for seeing period. Because now way they get ovulation now they lead to all the cycle they. But if you go block them, the woman go there in they see in period, so they bleed and that heavy menses business go don't come on day. It can even help for make it shrink the fibroid. The only disadvantage is now for temporary business where you stop for user tendency they say the fibroid could begin grow back. So the definitive management now one, you can actually pull the fibroid where the womb they you no do nothing for pull the womb, you just pull the fibroid then come on there, and so they find back the woman can able get belly and bone picky, you can able see in period normally. Or you can actually put the womb incest because I ain't get all this wahala. If you be say that woman they don't done for born, you not plan for born again, you can actually like the one that we don't reach menopause, you can cancel them. Or even if you don't reach menopause yet, but it don't complete in family size, then na management option than you go pull the entire womb, and that story the fibroid story go done. We call her hysterectomy. Other ways then they will they manage again way in it beyond the hysterectomy. Or other way where you could actually do the operation and where they open the belly you do or you can do a small wound on the belly, put camera inside, and then you use what we call laparoscope. In a advanced technology, you use camera for able pull the fibroid. You can also able pass that same camera they inside the vagina, go inside the womb for the fibroid the way they inside the womb, inside the baby they do. You can able go pull any kind of fibroids and then. So the other option of management we in an advanced technology again, we get people who they call radiologists there, then and then keep watching the X-ray there, MRI there. They also do what we call interventional radiology. Then they pass one kind catheter inside the vein, they go to the blood vessel that the pipe where they supply blood to the womb for making them go block down there. So where blood not go, they go to the womb, the fibroids and they begin die. But that you go do and for woman then we not plan for born again, because the disadvantage is if the fibroid die then the womb back die with her. Then not for force way plan for born picking again. Yeah. Now then get laser therapy where you can use particular device, you send radiation for just go attack the fibroids. But then they don't do it na salon. That is a therapy business.
Okay, and family member say yourself when you listen and watch you live on Facebook, you go call the number 077921981, or self you go na Wele Democracy Facebook page and ask question about the topic where they do it today when I'm living with 5 words what every woman should know. And the program na Body Tok, they come to you live from the Society for Radio Democracy 98.1 FM. Call the number 077921981, 077921981, and the number where you go call and ask question about the topic where they do it today when I'm living with 5 words what every woman must know. Okay, doc. So again, it possible for a woman we get this 5 words I don't do in operation, I don't pull and then it get them back.
Yes. So fibroid gets a tendency for recall, especially if this person first then the fibroid they been boku, when they do the operation they not been pull all, the one that we left they can continue for grow. And then if it be say the trigger waiting make the fibroid be the grow self, not be don't stop it. Even though you don't pull land, but you not stop waiting be the make the fibroid they grow, it will still continue for grow.
Okay.
So as long
take
as
this call now, this program quick.
yes, please.
Hello? Hello, good evening. Name and who call from?
Me na Idris, I come from McKinney.
Okay, Idris, go ahead and ask the question. Oh wow, dollars is Idris now the program. I'll say you call again and the number 077921981 and ask the question we want for ask. As today inside the program we talk about living with 5 words what every woman must know. The number for call now 077921981. We don't get another caller on the program. Hello, good evening. Okay. Okay, doc, go ahead.
So as I say, some people then they go do surgery, the fibroid can occur because the estrogen levels still high, so and they continue for cause the fibroid for grow. As long as you get womb, the fibroid get tendency for make it come back. The only way you no go come back again are where the womb not dey again.
Okay.
So that are the definitive treatment.
Okay, well, don't get another call on the program. Hello, good evening. Name and side call for.
How are you?
Fine.
Okay, this why I just make a light for the public seats or the causes of Bukuma. I just want to that fine. I just want to add more to our way they've been talking. One, a genetic factor, races, short-sighted people, trauma, high blood pressure, and drug terror. It's very terrorism. Thank you very much.
Okay, you're welcome, sir. Plenty. Thank you for that contribution that we make na the program. The number for call na 077921981, 077921981, and the number where you go call and ask question about the topic we do it today when living with 5 words what every woman must know. We don't get another call on the program. Hello, good evening. Name and who side the call for?
Yeah.
Yes, please come on here, radio, and ask a question.
Okay, ma'am. So the fibroids study talking about.
Hello?
Yeah, they get me.
Yes, I get you.
Fine, well done. What is fibroids? This fibroids really actual fibroids. I want to know about fibroids.
Okay, well, maybe you know be joining me at the start of the program because the doctor be don't talk about that. But go come tell you again waiting a fibroid.
Okay, ma'am.
Okay, plenty. Thank you. We joining at the program. Hello, good evening. Name and side call from.
I talk to Mohammed from Lunge.
Okay, Mohammed, go ahead and ask your question.
No, not a question. I will ask my assistant from the mommy and I ask one question.
Okay.
I get a woman where they say, like how the mommy they explaining, they let them go up, but they don't go look, they don't do scan, they don't do everything, nothing other than the womb, and they say assist. So I just want how the mommy go able to help, either for her meet them or help me with the number of that assistant in I want.
Okay.
Yes, ma'am. You don't, the belly don't pass nearly 1 month. I mean, 1 year. You go to 1 year, 6 months. I will say I let the belly woman, but they don't go do everything, not get the belly.
Okay.
Yes, ma'am. That's why I'm concerned. I will let the mommy help me.
Okay.
Okay, thank you.
Thank you very much. Hello, good evening. Name and inside the call form. Hello?
Yes, good evening. Yeah, good evening.
Yes, your name and inside the call form.
My name is Tamba. I call from Balang, Kaidan District.
Okay, Tamba, go ahead and ask the question.
Yeah, first and foremost, I want to tell Dr. Rizalita to go for whether the radio will educate me with regard to this all important topic. When you compare the rate at which the young when they get this fibroid now, when they're not even born yet, it is alarming as compared to the days of old, where we young parents and when they're born, we will not be able to get then experiences than this. Looking at the prevalence where it make this sickness here, it is spread so rapidly to begin and where they're not born yet, who we expect now then for take over the nation tomorrow for produce more offspring then. Why really this disease is so rampant now as compared to the days of old?
Okay. Plenty, thank you for that question. We ask now the program as the experts will respond to you. Hello, good evening. Your name and inside the call form.
Yeah, I was when they call from Manchester. I missed one or two programs then. I'm not in the line. Thank you very much.
Okay.
Just a bit of for both the team with Dr. They do and done a good job. I know there are challenges then. But the question I've been asked all the time, but to do with the gynae area, I know see one, did I explain this last uterine artery embolism, with embolization, that now outside the radiologist, they block the blood vessels, that's good, and level of estrogen for come and down. But now the area of how they can do it, let's say they have myomectomy, that now the other surgery what they do. Let's say somebody do them, but how much the success of them, wherein they will avoid the cervix for the damage. Because there was a time I asked bottom, but now in the other form, the cervix for let you know go loosen, what then go do what in a chirurgical stitching. After 4 to 7 weeks, woman get belly. See if that woman they go get belly, his cervix go down loosen. So anytime we get belly, then get for tie that suit that cervix they take it bone, then they remove them. That the suit of them they use to absorbable. That's not one. But the one I will ask again, now the DNC, I was a gynae doctor, not to the second one before this come. I mean, actually rule out the idea. I see they only do DNC, that are for dilatation and caress, that are for clean up the womb. In other words, for reduce the fibroids, really cause the bleeding, so that the woman will carry on with her life. So, but I don't know in terms of that sacrilege they want to sugar castige and they still do them, or it is occur for other reasons. Or what about the invasion when they can do during even the myomectomy, if you not do how they call them DNC? You see, so another one that I just want to know, not doing the DNC, but anything for do the cervix passage if you loosen, how they will maintain that. Then finally, I don't know if then they engage the fourth lady, because they address the silence of this thing recently. So but I don't know how much they come in the awareness for let them be able to challenge the areas of treatment and specialized care.
Okay.
So thank you very much. Become me there. Thank you. Yeah, go.
Okay,
Yeah,
thank you very much, Usfred, for that contribution in the program.
Yeah.
The program now with Body Talk, it comes to you live from the Society for Healthy Democracy 98.1 FM. So, Doc, you don't get so many questions, so I can't tell you for later we can respond to them.
Okay, the first one, somebody be want know wetin are fibroids again.
Yes.
Fibroids na growth wey can happen per woman in womb. We na dey normally we supposed to get belle pikin kile don na we call womb. Na dey fibroid can happen, but this fibroid are not to cancer. Na just growth wey can happen. It can happen naturally. Bokuten and the reason on kinde why make it happen. We not able investigate it for no na this reason. But the thing then they win at the risk factor there where I mentioned now that a possible way in get family lineage way then can get boku fibroids, being black, you then a reproductive age between age 16 to 49, possibly exposed to estrogen level, and possibly get body, then get risk for making they get cancer, fibroid. So somebody mentioned about a get fambuna longi we a get belle they can up with them physical
for over 1 year, 6
for
months,
over 1 year. What I go tell you is Kana Cottage for Beirut where you come na 2 hospital day inside the Pikin hospital day, the Uma hospital, no to belle Uma no more. So we get what we call gynae clinic. When a Uma they will not get belle, their own clinic, they separate from a belle Uma their own clinic. Just can't say na Uma we no get belle, he can for can make they can see am. Monday to Thursday clinically. In fact, where I come on, so just the way I come on, and gynae clinic I come on 4 o'clock before the can yeah. The clinic they run from 8 o'clock to 5 in the evening. So where you can they thing we get for do with Uma a born business, you go come whether na picky one born, whether na fibroid, whether na cancer, or any aspect you can in na cottage PCMH, yeah, Princess Christian Maternity Hospital. Then somebody asked again, say the rate at which fibroid they occur in young people there now. Yes. So we lifestyle changes them, but who now? First, people there, so then cassava leaf, they sabi eat and potato leaf, and now we sabi eat all the fried chicken there and fast food there. So we lifestyle different from their own. And first time, people there, you won't go say they're not being get body, but they be look more healthier than we. Nowadays, you go see somebody young, but you get body past how it's supposed for day. So some of the things that they we make mama them before and we different. And nowadays again, we get aspirations there for achieve goals there. So some people like delayed and childbearing age. So Bokuti then they your body go they exposed to estrogen for long period where you not born yet. So all landing a risk factor then. Then somebody been they ask about clarification for myomectomy, DNC, and cyclage. So all them in a 3 different procedures the way he asks. So myomectomy, they do where somebody get fibroid, you want pull out fibroid, but you left the womb day for making the womb continue for work. Now in a myomectomy. Then for the Siroka way they say they call and cyclage, you get different types they offer. Then they happen where it be say possibly the bone blight, the cervix. It be say in the able old pregnancy because it insufficient or some go say incompetent. Then another time they use that cervical stitch, but not because somebody get fibroid. Okay, now because the cervix don't the able old pregnancy to term, now you go use the cyclage for. Then when it comes to DNC, we tend for move away from dandy because some of the practices and they before where people they do and now we don't find out say they get side effects there by people there. We try for modify we practices there to the way we not go get much side effect on somebody. DNC first they use iron for like crepe all thing come inside the womb. Now what would they use now manual vacuum aspiration plastic tube where in gets where it is suck something come inside the womb without crepe all thing come inside the womb. Okay. Because first the way they do DNC somebody go there not see period again, able born again because they don't do DNC panel. So DNC only do one because we want pull fibroid. If we go with something inside the womb for pull fibroid, we call a hysteroscope. Then a camera with the care go, we get specific device and you see what they go pull exactly under a diet view, then you pull a commode, then a hysteroscope, but not to DNC than for fibroid, now myomectomy or hysterectomy, that we pull the womb completely. If the person don't do for born, you don't need the womb again. Yeah? Okay. So now 3 different procedures then they not to the same thing for different reasons. First, the way they do DNC for somebody get miscarriage, they want clean the womb down, or some people they can just sit down and say, me, I want to go do clean, I want get belly, but then they not day into practice now. If you want get belly, investigations and they will do for find out if you womb patent or not that we will go do DNC for find out if you get belly because I try and error something that day.
Okay, so this one from Facebook page from Abiba to today they say, doctor, if person gets belly together with big fibroid, it advisable for make them do operation for born the pikin and pull the fibroid.
So person can get belly where they coexist with fibroid. We they only go do operation for pull the pikin if it be say the fibroid e dey dung na the womb, the pikin no go in head no go able comot, or the pikin body no dey able comot, the fibroid dey block am. But if e be say the fibroid dey up side na the wound wey e no dey affect outside the pikin dey pass comot, except other reason dey wey we go do for make you for operate you, other reason dey maybe something the afterbirth day before, other reason na im go make we go do operation. But just for fibroid normal, we no go do operation for that day. However, if the fibroid dey dung wey the pikin no go get passage, then definitely they go need for do operation because the pikin no go able comot, it go obstruct. Yeah, and then they go make we go do operation. Why is the post for pull pikin? And Bokuma go want ask that question, say where I get fibroid, they do operation for pull the pikin and go pull the fibroid. The fibroid na only the one where they na the way for pull the pikin, and it go pull at that moment where the woman pregnant. But any other one where they know they na the way, it advisable and recommended for make you wait where the woman don born after 3 months to 6 months. You can plan the surgery because during pregnancy the blood supply where they go to the womb is huge. If you say they go first for pull fibroid at that time, the woman go bleed, and if that woman they bleed to death, then they go say you na reckless doctor.
Okay, so Doc, the California and the studio wait to go be key message so woman them about early detection and safe treatment.
So I go tell all women come to woman then say, dear, more no wait say the belly begin at we before they go na hospital. More go they go regularly for go check up. Every woman, every 6 months, you supposed to go see doctor. We not to for malaria, you just go check your woman private partner for find out if any problem there. And if you get problem, no sit down, they cry inside with them. Just go na health, the nearby health facility. Cottage we get poku master sabi people there we know about woman business, whether na born business or just woman business, then go see you. And you can go there Monday to Thursday for the gynae clinic. And if you get emergency, whether not to Thursday or whether na 3 a.m. with hospital they work 24 hours. With theater they work 24 hours. So do ya more no wait till we get problem before they go hospital. More they actually go before the problem in the car. Because beaucoup people then they apart from this fibroid, then get cervical cancer, then they reach where they don't they in advanced stage. It is sad for really watch. So dear more go they go for screen for different diseases, then whether na cervical cancer, whether na breast cancer, whether na for fibroid, more help we safe. Yeah? Now thank you.
Okay, plenty thank you for joining at the program. In name na Dr. Rosalita Jaida Tugagu, in a senior registrar obstetrician and gynecologist at the University of Salon Teaching Hospital Complex. As today in the House of Talk about living with fibroids, what every woman must know. Plenty thank you for joining at the program. And to the one they always call and ask question, one for say plenty thank you for listening to the program Well Body Talk. And not forget, say next week Thursday when at the next edition of the program Well Body Talk, we get for ask question about some of the things and way we talk about today at the program when are living with fibroids, what every woman must know. So you go call again next week and answer to the question that we'll get for ask and get you 50 million stop up. Well, now this edition of the program Well Body Talk go left for today, Thursday, March 19, 2026. Plenty thank you to me producer Musa Kamara and DJ Randy for in technical support. Fatmata Samuel will make on watch you live on our Facebook page. And we present this edition of the program Well Body Talk. My name is Karifa to contact say bye bye.
No condition. The condition is permanent. Yeah. No condition. The condition is permanent. Oh yeah. No condition. The condition is permanent.